Procedure. I'll be starting off first with having clean gloves. I'm going to need a medium-sized basin that's going to have some pretend warm water. I'm going to have a cloth which I will use as for cleansing. We can also say that these are wipes that have like soap in them, so that's what we're going to use to cleanse out the perineal area. So that we also have a urinary catheter kit. So this box is what we're going to be giving to you guys. Remember, we're going to be using this. You're going to be recycling this for use again, like for practice, and you're going to want to make sure to bring this back for testing. So take very good care of this. Remember to again feed it every day. It's going to have sterile gloves on the inside, but I like to use different sizes of sterile gloves than what's provided on the inside. So these sterile gloves, you'll find them in down there. So 6, 7, and 8 is basically small, medium, large. So I am 7. Okay. These you don't have to worry about recycling. Just use as many of these as you need to. Okay. All right. So that's all I'm going to need for the test. What you're going to want to do is just gather all your supplies, and you're pretty much going to be ready to go. You have this with you. You have these. Most of these are going to be provided to you, except for the kit. You have to make sure you bring this, and then you just bring that checklist with you. So you want to hop over and be my proctor. So Amy is going to be my test proctor. The test proctor will they'll act as many different roles in the testing process. So first off, of course, they're going to be your test proctor. So they're going to be watching you, grading you on what you do. They're not really going to be giving you any advice while you're doing it. They can give you advice before, and they can talk to you guys about how you did after. But then during the procedure, they are not allowed to, and they won't help you out. So you kind of have to figure it out on your own. It's a test. They also act as the voice of the patient. So if you have any questions to ask the patient, they'll be vocalizing for the patient for you, or for the patient. They also act as nursing assistants. So if you forget something, sometimes you can ask them, and if it's within their capability of getting it for you, they will get it for you, depending on how they're feeling that day, if they've had coffee or not. And then also, they act as patient family members sometimes. So if there are instances later on with tests where patients aren't able to talk, they play that role too. So they're a multi-person role, basically. So the way that this starts is I'm going to come in with my stuff, we're going to talk about the patient a little bit, and then you're going to ask me if I have any questions usually, right? And I'll say no. And I would hand over my checklist to Amy, and she's pretty much going to go over it, and then whenever you're ready to start, they're going to ask you. So, I guess I'm ready to start. So, we always start off our scenarios by imagining that we're outside of the door. So, we would have to knock in and everything like that. So, what that would look like is you're going to knock.
Come in.
May I enter?
Yes, or come in.
You guys see what I did there? I waited for the all clear before I entered. I want to make sure you do that. Just knock it. Sorry. Does anybody watch The Office? Damn it. Okay. Yes. Anyway. Did you get it? Okay, cool. Alright, so knock on the door and come in. You want to then do hand sanitizer and then provide for privacy. So we don't have actual curtains here, but you want to make sure you imaginary close the curtains to provide for privacy. Okay, so I've done all that. I'm going to introduce myself now. So hi, how you doing? My name is Sean. I'm going to be your nurse for this afternoon. So before I get started, can I verify your identity? I just need to double check your wristband. Okay, so can you please state your first and last name?
Guadalupe Diego.
And your date of birth, please?
7459.
Perfect. So I want to make sure I'm working with the right patient first before I start explaining the procedure. Okay. So what we're going to be doing today is a urinary catheter insertion. Do you know what that is?
No.
Okay, so we've noted that in the last shift, the nurse noted that you're having difficulty urinating, that when we brought you to the commode, you only put out 10 milliliters of urine. Is that correct?
Correct.
Yeah, and then you mind if I go ahead and take a look at your abdomen?
Sure.
They were saying that it was, that's pretty distended. I'm just going to palpate a little bit. Is that pretty painful?
Yeah.
Alrighty. Okay, so because of this, we noted that you have urinary retention, where urine is kind of just staying in the bladder. So what the doctor ordered is to have a urinary catheter inserted. It's basically a soft tube that's going to go up your urethra, and it's going to go into your bladder, and it's going to help to drain out all the contents of your bladder, so it's not going to be as full anymore. So, do you have any questions for me?
Is it gonna hurt?
It might be a little bit uncomfortable. You might feel a bit of a burning sensation too. So if at any time you feel like it's too much and it's too painful and you don't want it, just let us know and we'll stop the procedure. Otherwise, I'll try to be working as quickly as possible to minimize the amount of time that you're going to be in this catheter. Okay. I have a couple of questions that I need to ask you before I get started. So, are you allergic to latex or anything like that?
No.
No. Okay. Cool. Are you allergic to shellfish by any chance?
No.
So, the reason why I asked that is because we use iodine in our urinary catheter kits to kind of clean up the urethra before we insert, just to keep it pretty sterile. I think nowadays they say that the iodine doesn't really have shellfish, but then it's in the rubric, so we're just going to be going through that still until they say, like, absolutely don't ask. Anyway, so you're good? Mm-hmm. Okay, cool. The last thing I need to make sure is we're going to be lifting your legs up to the point where your knees are going to be kind of hanging up. So are you going to be needing any assistance in keeping your legs up or anything?
No, just for positioning.
Okay, cool. Then I'll definitely help you out with that. So pretty much I've got all the information that I need to start my procedure. So what I'm going to do is I'm just going to go ahead and get started. I'm going to move this table out of the way. Here, put some gloves on. And I'm going to start raising the bed up to a workable height. So. How you doing?
Good.
So that right here for me, again, waist height. I'm going to bring the side bed down, and we're just going to go ahead and position your legs, okay? So I'm just going to draw back the blanket over here. Make sure we don't expose you or anything like that. So I'm just going to go ahead now and start lifting your legs up, okay?
Okay.
Alrighty, so let's get that one up here. Let's get this one up here too. And you really want to make sure you kind of open up. Okay. So there, sometimes you might need to push the knees a little bit just for these mannequins. Hopefully you don't have to do that for your patients. Okay, so first thing I'm going to do is I'm just going to go ahead and cleanse the area a little bit. So I'm going to bring this over with my basin, take these out. I'm going to fill this up with imaginary warm water. So can you check the temperature of the water for me, please?
Fine.
Good, not too hot, not too cold?
It's good.
Perfect, okay. Don't do that. So, yeah, I've got my basin of warm water here. If this is a cloth, then I would have a mild soap that I would use to clean the area. We're going to assume that these are wipes that are made to clean and stuff like that. So I'm just going to pop this into the water. Okay, I'm going to expose you a little bit here. And I'm just going to cleanse the area. I'm not going to do any kind of scrubbing motion. We do top to bottom. So I'm going to get that wet and go top to bottom. Just one wipe. And then I like to grab the corner of the towel, flip it over. And then do the other side, wipe downwards. And then flip it over. Get that wet and just down the middle. One more time. That's it. You can just do 3, and that'll usually be good. Okay, so I'm going to take my gloves off. I'm going to put this down here. Now, this is where it's going to get kind of interesting. So, hand sanitizer. Do my hands one more time. Thank you. And I'm just going to go ahead and put this off to the side. Or Parker will take care of it for you. Sterile technique. So I'm going to be opening this kit, which contains a box of sterile contents. So there's a way that we open it. There's a way that we treat everything. So I'll start off first by positioning my table appropriately. So remember how I mentioned that if I turn my back to my sterile field, the entire thing becomes unsterile. So you want to work in such a way that everything is kind of within this sterile field, or this like my field of vision. So that, let's say for example, if I position this inappropriately, like maybe over here or something, I'm doing all my stuff here, then I transfer everything here, and like everything stays here, all this becomes unsterile. So you want to make sure you create a workspace for yourself that's all within your field of vision. So I typically like to go about right, I don't like this side table, right here. Okay. All right, so I'm going to now open my kit. yeah, when it comes to throwing stuff away, it helps to have a trash can kind of right at your feet. Otherwise, what you want to avoid doing is like dipping your hands below your waist, especially when you're sterile. If you get your hands below your waist or above your shoulders, your hands become unsterile. So sometimes what you might end up having to do is stepping back and just dropping stuff either on the floor or into the trash can that's over there, because you don't want to turn around and throw it over here or go over there and throw stuff away. Okay, so I'm going to now take my box out from here, put it on my table. I'm going to turn this bag into a trash can. You want it so that it's laying open like that. Okay, cool. So, the box. The way I open it first is they've got these corners right here. You want to start by opening the first corner away from you, not this way. Okay, so open it away, and then these two on the sides, and then down the middle. Note that when I'm holding these, I'm only touching the outside. I'm not grabbing the inside and opening them. So you can only touch at the very least, or the very most rather, just like the very corner of it. But you want to do your best to not touch anything on the inside. So you just kind of grab the edges over there. And the last thing will be to be opening away from you, okay? Or opening towards you. So a couple of things in here. You might see two ways that this is done. So in the kit, you have this drape right here, and you have sterile gloves. Some people will do this without gloves first, where they're going to take this, open it up, and then put it onto the patient, or put it onto the bed of the patient. What I typically like to do, though, is I like to put my gloves on first, and then handle all this stuff. So I'll show you guys what that looks like. So I get underneath the box first, and I turn it like this, so that I have a larger workspace over here. If I leave it this way, I'm not really going to be able to open up my gloves safely without risk of contamination or without risk of breaking sterile field. So get underneath, turn the box this way. Now I'm going to put my sterile gloves on. Remember that everything in here is sterile. So if I do this, if I do that, if I turn away, this becomes unsterile. So sterile gloving. This is a mini skill within the skill. You're going to unfold and open this up. You'll see that they have like flaps on the insides right here. These are the only ones that you want to touch. You don't want to get inside and do all that, because that would make the entire thing unsterile. So what I do is I walk off to the side. All of this is still within my field of vision. I'm going to then open this up like that. And then I'm going to put the sterile gloves on. So the sterile gloves, the things that are sterile on this glove are pretty much just the outer surfaces of the entire glove. The cuff, you'll see, is kind of folded upwards, and this is pretty much going to be the inside of the cuff. So when I put this on, that part's going to be touching my skin, therefore the outer part still remains sterile. So typically the way I like to do it is I like to start off by gloving my non-dominant hand first. I'll take my watch off. So I start my non-dominant hand first, and then I'll glove my dominant hand. So the way to do it, you grab the inside cuff just like that on this bottom part. We don't ever touch the inside over here, or the outside over here. So just grab that part. You want to do this with your fingers and just snake your fingers in there, okay? The next thing you're going to want to do, you can't do the same thing by grabbing the cuff over here and putting it on, because actually you can't do that either. You can't touch this, sorry. So you would have to just shake that off. You can't do this and put your hand in there, because my hand is touching the inside, and then all of a sudden you want to think of it as like a bunch of germs are going to run up to the sterile part of this. So the proper way to do this would be to, you get your fingers and you go underneath the cuff like that. So it's going to be inside of the cuff. You guys see how that's kind of in there? And then you're just going to slide that over your hands like that. Then you just pull that and you're good to go. Okay. So from here, you can keep this on the table. You can get away and take that off if you need more space. And now I can go ahead and touch everything that's in here. Because my hands are sterile, this is all fine. Oh, I looked away. This is all fine. So I'm going to take this drape now, and I'm going to open it and put it down onto the patient's bed. Note that it has a dull side and a shiny side. So the shiny side is the side that should be facing down, or should be on the patient's bed. Okay. So I'm going to open this up and very carefully, lay this down onto the patient's bed. So what this will do is it'll act as a second sterile field. So I can arrange my stuff here, and I can move it onto here, and that would still be maintaining sterility. Okay. So if while you're doing that, for example, the drape touches the leg, or I do that or something, and I break sterile field, for the test, I want to make sure you guys acknowledge any of the mistakes that you make. So you verbalize, oh, I broke sterile field. And then pretty much tell us what you did, and we'd let you continue from there. And I'll talk more about that towards the end, what would happen if you don't, okay? So, got my drape over there, and this is where I mentioned you got sterile gloves in here. I'm just gonna drop these down. And I've got this. This is a fenestrated drape. Very nice. Perfect, thank you. There you go. So, if we're working with a male patient, you would use this fenestrated drape. So the fenestrated drape basically just has a hole over it. So you would take this and you just go to things like that. Like that. There you go. And that will help to isolate the fetus and everything like that. So we will not be using these with females, so I will not be using this at this time. Yeah, don't put it away. You can use that one too. Thank you. Otherwise, if I'm not going to use it, I would just drop it and throw it away. Okay. Now I'm going to take my kit, and I can touch everything on the kit. I'm just going to take the top tray off, and I'm going to set everything up before I move it. So, easiest way to remember everything that you're going to be doing, you want to go on the top of the tray from left to right. So the first thing that I have is this normal saline. This is what we're going to use to inflate the balloon. So you're going to want to take this and disconnect this, and this gets pushed into here. And we used to practice inflating the balloon to test to make sure that it works. We don't do that anymore. So just pop this in there, put this down. Okay. So the next thing is we have the iodine. So this is what we're going to be using to cleanse the urethra and everything like that. So for the lab here, we just pretend to open it and pretend to squirt the iodine onto here. They stain the mannequins pretty badly. So we're just going to broke sterile field. We're just going to pretend to put it on, okay? So, but make sure you go. You have to make the sound effects. I'm just kidding. Okay, so this is good. I'm just gonna throw that away. So my cotton balls are now saturated. Then I'm gonna use the lube. We would just pop this open, squirt a little bit of it on there. Remember not to use all of it because you guys are gonna be reusing this anyway. So take that and throw it away. Now, last thing I want to do is I'm going to take the sleeve off of the catheter very carefully, as to not make sure I don't oh shit, or that kind of thing. So be very careful of the tip. Then you just drop this, and you want to lubricate your catheter. You only need to go maybe about 2 to 3 inches if it's a female, and if it's a male, you want to go maybe about 5 to 6. The number is in the rubric. I don't remember it off the top of my head. There. Yeah. Okay, so I've gotten everything pretty much set up. I'm ready to now insert the catheter, so I'll move this over right here. The first tray that's going to be closer here is the tray that we're going to use to clean, so I'll have that over here. Okay, so I'm going to start off first. I'm going to commit one hand to being unsterile now. So this is what we talked about in the quiz. So now that I've touched the patient here, I can't use this hand to oh crap, I forgot to do something and touch stuff over here, because that would make the entire kit unsterile. So I'm going to use 1 cotton swab, and you can do either 3 or 5 strokes. So if you're doing 3 strokes, you just separate, you get the inner labia, clean that from top to bottom. You take this and you throw it away. You get the other one, top to bottom, and you throw it away. Note that we're only using 1 swab, and we're not kind of going back and forth, just top to bottom. And your last one will go top to bottom, right down the middle. Down the middle. Okay. If you're going to be using all 5, it would be outer labia, and then inner, and then down the middle. Either one is fine. Okay, so let's say I finished cleaning all that. I'm just going to pick up this tray. I'll move it over to the side. I don't need that to be sterile anymore, so I'm not going to worry about it. Now I'm going to insert my catheter. So you pick up the catheter, make sure it's nicely lubed. I want to hold it a little bit closer to the tip. If we hold it really far away, and try to insert that, it's going to be like, and it's not really going to work. So, and it's also going to start like kind of bending too. So hold it somewhat close. You're going to separate the labia, and you're going to ask the patient to bear down or to push as if they have to void or as if they're going to pee. So on 3, I'm going to insert the catheter. If you can bear down or push as if you're going to pee, it would help with the insertion. Ready?
Yeah.
Okay, 1, 2, and 3. So we're going to be inserting the catheter. Things to be mindful about. Make sure this right hand, as you're doing it, you don't want to push into the patient to the point where you're banging your hand into their, because that would make your hand unsterile. Okay, so you want to be very mindful that you're just pushing the catheter. Okay, so when we're doing this, you want to get a little bit more than halfway for the mannequins in order to make space for the balloon. But in a real patient, you're pretty much going to be inserting it until you see urine output. For the test, we're going to say, let's see, we got to say here. You're going to imagine that you see urine output coming out of here. You're going to say, oh, okay, I see some urine output, so I'm just going to go ahead and insert another 1 to 2 inches. All right, and you'll stop. So from here, you're going to take your non-dominant hand, and you're going to grab the catheter and hold it in place. This is okay because I'm not pushing the catheter in anymore. Okay. You want to hold it in place because what you're going to be doing with your other hand now is you're going to be inflating this balloon. If you don't do this, likely the catheter is going to come shooting out. So you want to make sure you hold this in place, and you inflate your balloon. Okay, note that when I'm done, I'm going to maintain constant downward pressure on the plunger because if I let go, it's just going to come back up on its own, and you're not going to get a full fill of your balloon. Okay, so push that all the way down. Keep pressing down on the plunger. You can remove this hand now and help you remove the syringe from the patient or from the balloon port. Okay, so that's pretty much done. You'll notice that our patients will have these clips on them. These are called stat locks. So we'll put this into a clip right there. Oh, and I'm actually going to also pull and tug on it until it stops. There you go. You want to tug on it to make sure that it's anchored into place. Okay, do that tug, and then you would clip this onto the patient. So the arrow on the stat lock points in the direction of the tube as it goes back into the patient. And yeah, so at this point, I will just move this out of the way. Sometimes your gloves will be like covered in iodine, so you can take them off now. Move this out. Okay. Reposition the patient back into a comfortable position. And then I'm just going to go ahead and hang this on the side of the bed. You want to make sure this hangs at a level lower than the patient. So typically, you guys can see over here on this side. I'll move it over there on that other side for you guys. But it's on a part of the bed that when we drop it down, it's not going to touch the floor. So on that side, it's going to look like that. Perfect. So again, we just want to make sure that the bag hangs freely and doesn't touch the floor when we lower the bed all the way down. Okay. So we've got that. This is draining. We don't see any issues with it. All the tubing is not kinked. Everything looks good. Okay, so now we're just going to finish making the patient comfortable. So I'm going to clean it back up over here. I'm going to bring the blankets back up over here. Thank you. Okay, then I'll bring the side door back up. And I'm going to lower the bed all the way down. So as I'm lowering the bed, I can start asking the patient a couple of questions. Basically, after every procedure, you always do an evaluation and a teaching. So how are you feeling? Good. No abdominal pain at this time?
No.
Everything's okay, good. So if at any time you feel like the catheter is really uncomfortable, you feel a lot of pain and burning at the site, please let us know. We'll come in, we'll take a look at it, and we'll remove it if we have to. Do you have any questions for me?
No.
Okay, cool. So here's your call light. If you need anything, just go ahead and press this button, and somebody will be here to assist you. If you need me, then I'll also be here as well. Okay. That's it. So before I leave, I'm just going to want to make sure one more time, double check the urine drain bag, and if I see something, which in the test you will see something, you want to make sure you verbalize this to your test proctor. You're going to say, So I'm going to record that the patient right now has 600 milliliters of urine output. It's clear and not cloudy. That's all you really need to say. Color, clarity, amount. So I'm going to pop this back down, and then I'm going to clean up all of my stuff. And I'm going to return the patient's belongings back. If they need anything else. And then, yeah, is there anything else I can get for you? You all good? Yeah. Okay, cool. So I'm just going to hand sanitizer and then leave the room, provide for privacy. And that's it. You would tell the proctor when you're done. Usually if you miss something, they're going to be like, are you sure you're done? You should do everything. But for the most part, when you're done when you say you're done. Okay. So, I'm done. Okay, questions about the test? Thank you. Golf clap. Questions about the procedure? You guys unclear about anything? No? For males, it's going to be, of course, slightly different. So, I've got sterile clothes on. Positioning for the legs for the males, actually that's one thing I forgot to tell everybody else. They can have their legs up. Typically, I like to make sure if their legs are down, you just open up the legs like that, and you have a space for you to do that. But you can also put their knees up. Either way is fine. So I'm going to start off by cleaning. So to clean, we would grasp the penis, not with your bare hands. And you want to clean like you're peeling a banana, basically. Top to bottom, you just go down like that and then throw it away. And you do all 4 sides. Down like that. And then the last one, you want to just kind of do a 1 circle swipe at the head and then just throw it away. And then your insertion is going to be the same. You're just going to insert, and you're going to want to make sure you get a good amount in there. Okay. And then you're going to, again, inflate the balloon. Tug to make sure that it's in place. And you're pretty much set. Now, note that with the fenestrated drape, we don't want you to like snake it through or anything like that. For practice, make sure you remove the catheter first and then take this out. But on test day, if you get in a male, you can just rip this off because that's typically what you would do in clinical. You're not going to reuse it again, so just rip it off for the patient and then throw it away. Okay? So there's that. Now, what I'm going to show you guys is how to remove the catheter. So, that's one way to do it too. Okay, so to remove the catheter, you're going to want to make sure you have a Chucks under pad. I usually put 2. I have 1 down there. And then pretending that this is another Chucks, I would hold this kind of underneath the catheter like that. So I'm going to first start off by wearing gloves, and I'm going to deflate the balloon. Okay, and then you want to pull the catheter out in 1 fluid motion. You don't want to be very slow about it. So you're just going to ask the patient to bear down, and on 3 you're going to pull it out. So okay, 1, 2, 3, and you just pull it out. And then you grasp the end of it, and usually I like to wrap it into that, and then throw it away that way. The Chucks is going to be there to kind of pick up any of the residual urine that's going to come out, because you still kind of left like a gap for urine to start coming out. So, yeah, so that's how to remove your catheters. Okay, questions about any of that? Not all. Fine.
That's clean gloves, not sterile.
Yeah, it's just a clean procedure.